2 o'clock. So, we ready? All right. So today we're going to talk about functional, nutritional, and herbal strategies for managing hypertension, high blood pressure. I'm assuming that's why you're all here today to hear about this. This is who I am. My name is Dr. Podlaski. I'm licensed here in Florida in chiropractic medicine, but I also have a naturopathic medicine degree. I have a medical degree. I have a bunch of board certifications in clinical nutrition, internal medicine. So when I put these talks together, it takes me months to make sure that everything I'm telling you is actually verified and referenced. And that's why I like to throw out junk that's not part of this and only give you the good information that I've really researched. Our office, I am allowed to say this according to the library, our office is located right here in the Villages. I'm in the Santa Fe Professional Building on County Road 466. So I have to give this little disclaimer today. If I was going to talk about the latest, newest medication for blood pressure, which I'm not, I have to make my son, who's an attorney, happy, make our friends at the FDA happy, that I'm not telling you to stop taking any of your medications or drugs that your doctor has put you on. That's a discussion we have with patients on an individual basis if necessary. But I am going to give you some information about natural treatment for hypertension, diet, lifestyle, nutrition, things that people really seem to be very interested in. So everybody okay with that? All right. So maybe some of the things I'm going to talk about today are a little different than what your doctor has told you, Dr. Google has told you, or your neighbor down the street has told you. But we're not going to step on your toes too hard, but I just want you to think a little bit today about what we're talking about. A lot of the information can be found in a book I wrote with a friend of mine. And one of the quotes I really like from our book is, if you treat your health today, you won't have to treat your disease tomorrow. So think about that a little bit too. So the focus of what we do in our office is really what we call functional medicine, functional nutrition. Basically, yes, we do look at your symptoms like most doctors do, but most doctors, unfortunately, don't have a whole lot of time to go into a whole lot of other things with you. Questions I ask every patient every time they come in my office. How's your sleeping? How's your stress level? How's your diet? Are you eating properly? Are you exercising? Are you drinking enough water? What else is going on new with your life since the last time I talked to you? Most of the time, when you go to traditional doctors, yes, they're focused on your symptoms, but we realize all these other underlying things, just like the tip of the iceberg is not the dangerous part, it's what's below the surface that you have to look at. So we look at lifestyle things. Again, what you're eating, what you're drinking, what you're exposed to, environmental issues. And even genetics can have a little bit of a role to play in all this. But thankfully, there's a whole new science called epigenetics, which we'll talk about in a few minutes, that has to do with how you can really compensate for the genetic variabilities that you may be born with. You can't change your genes, but there's things you can do with diet, lifestyle, nutrition that can bypass or correct for genetic variabilities or even genetic defects. So we're mostly focused on trying to find the cause of people's problems rather than just trying to cover up your symptoms. And certainly in our office, we don't do any drug therapy. It's all natural medicine. But unfortunately, a lot of times when you go to a doctor, it's not an unfortunate thing, but doctors have to follow what's known as the standard of care. Now, the standard of care can mean different things, but unfortunately, the unfortunate part is actually in the United States, when you go to a doctor, and it doesn't matter what condition you have, whether you go to Johns Hopkins or Cleveland Clinic or Mayo Clinic, for the same problem, you're pretty much going to get treated the same way for the problem that you have. If you have a thyroid problem, there's certain tests, certain medications, end of story. That's the standard of care. Another good example, you go to the doctor, you have your blood test done, and they find your cholesterol is above 200. You've committed a sin. Your cholesterol is above 200. Now you need to be on a statin. And it doesn't matter where you go. That's the answer that you're going to get. And we're going to talk about that today as well, as that's not necessarily the truth about all of that. So really, health care has evolved to mean, and you know this yourself, what's your health insurance? I mean, what's the first question usually you're asked when you when you call up a doctor's office? What insurance do you have, and are you covered? Does our office take that insurance? We don't deal with that in our office at all. So here's you with your symptoms, your problems, your health challenges, and then you call the doctor, and the doctor has to fit into what's known as the doctor's payer box. In other words, They have to make Medicare, Medicare Advantage, HMOs, PPOs happy with the tests that they're doing, with the treatments they're recommending, again, to fit in with the standard of care. And unfortunately, a lot of times, some of the things that the doctor would like to do or tests they'd like to do, oh, sorry, that's not covered by your insurance. We really can't do that. So it leaves you in a quandary, leaves the doctor in the quandary what to do next. So functional medicine doctors, again, looking at the root cause, we go beyond just thinking outside of the box. We look at your diet, lifestyle, nutrition, exercise, how much water, how much stress you're having in your life. Nobody here is stressed though, right? You're all retired in the villages. Everybody's stressed, right? To one degree or another. Turn on the TV, turn on the radio, read the newspaper, get on the internet. So the bottom line for functional nutrition doctors is treat the patient right. Let's look at all these other questions. And yes, focus on symptoms, but that's not the be-all and end-all. So the doctor will be with you in a few minutes. He's trying to figure out what disease goes with your insurance, unfortunately. Okay, so what's really wrong with the standard of care? And I found this on the Medicare website. Care that seeks to prevent disease, promote health, prolong and enhance the quality of life is not considered medically necessary and therefore not payable. Does that bother anybody?
Yeah.
It should, especially if you're on Medicare like all of us are. That's a problem. But they don't want to pay for things that may prevent you from getting sicker in the future. Good example. Medicare will pay for $100,000 for you to have a heart bypass operation, but they don't want to pay for a couple $100s a year to prevent it from happening in the first place. So we're kind of backwards. So most people go to their doctor, they're following their doctor's advice, but they know that they can feel better and they feel there's something missing. So I call that being part of the walking wounded in the healthcare gray zone. You're doing everything that your doctor tells you to do. You don't quite feel as well as you would like to, and you keep wondering, is there something missing? Is there something that we're not doing that I should be doing to make me feel better? And so it's very frustrating for a lot of people when that happens to them. So functional medicine doctors, functional nutrition doctors, basically are holistic healthcare detectives specializing in the walking wounded in the healthcare gray zone, trying to find the root cause of what's causing the problems for people, which ultimately gives you your symptoms. But let's figure out different ways to fix it as opposed to, well, we've got a pill for every ill, we have another drug for you. So today we're going to talk about the truth behind the lies you've been told about heart disease, hypertension, and cholesterol. We're going to talk about that a little bit. We're also going to talk about the 6 major metabolic imbalances that create high blood pressure problems and cardiovascular disease. We're going to talk about the dangers of some commonly used medications that your doctor routinely prescribes for your hypertension or for your cholesterol. And we're going to talk about ways that you can protect yourself from heart disease and hypertension. And we're going to talk a little bit about some nutritional or natural medicine alternatives to dealing with all these issues. So hypertension, it really is the silent killer. A lot of people don't really realize, unless they go to their doctor and been told it, that all these other underlying issues can be a reflection of what's going on with your blood pressure. And very often people are not aware of these other underlying issues. Maybe they're aware that their blood pressure is elevated because their doctor told them or they checked themselves, but a lot of people don't realize that all these particular problems can be underlying or caused by your blood pressure problem. And there's ways to change all that. Many times I'll see patients that come into the office and they're on 3 or 4 different blood pressure medications and they're still having a blood pressure problem. It's still not under control. So there's got to be another answer for them. So recently, the American College of Cardiology and the American Heart Association have revised all the blood pressure readings, which a lot of us disagree with. Basically, they want all of you to be below 120/80 for your systolic and diastolic blood pressure. In other words, they want your blood pressure to be lower than that. Well, the problem with that, as you probably know yourself, as you get older, you realize your arteries get a little stiffer, and naturally your blood pressure does go up a little bit. And actually, sometimes it's actually healthier for you to have a little bit higher blood pressure. And there's a lot of studies that indicate that's a great way to prevent Alzheimer's and dementia by having a little higher blood pressure. Now, we're not talking about 180/100 or 190/150, but a little higher than this 120/80. And there's so many times that people come in and their blood pressure is down low now because their doctor is insisting that they get below that 120 over 80, and they're dizzy and they're lightheaded and they have a headache and they just don't feel well now that their blood pressure has dropped down and they're fatigued. So there's different categories now that they've gone through. Elevated blood pressure between 120 and 129, the systolic, and the diastolic is above 80. Stage 1 is between 130 and 139, and 80 to 89. Stage 2 is greater than 140, and then you're in hypertensive crisis if you're greater than 180 or 120. So yeah, that's really true, but some of these areas in between we need to look at a little more closely. So let's talk about some good news, though. Some good news is that everybody seems to be living longer. We have a longer life expectancy. People are living longer in retirement. Back in the 1920s, it was 61 years. Now it's 78. Some of us are past that, right? Some of you are past the 78. Unfortunately, though, they're predicting by 2030, in a few short 4 years from now, the number's actually gone down. Anybody want to know why? Because of COVID. COVID lowered the life expectancy for people. Some bad news: cardiovascular disease, heart disease, hypertension is responsible for 50% of the deaths annually. It's still the number one killer in the United States, despite all the blood pressure medication and all the statins that people are on. It costs billions of dollars, and we're talking about things like stroke, heart attack, angina, atherosclerosis, clogged arteries, and blood pressure elevation. Nearly 50% of Americans, of adults in the United States, have hypertension. That's a pretty high number. Sometimes, though, I wonder if that's because now everybody who's above 120 is considered hypertensive, or if you really do have high blood pressure or not. Hypertension is basically into two categories. There's primary or essential hypertension, which, in all honesty, they don't really know. The researchers really don't know what the real answer is. But those of us in functional medicine, functional nutrition know that it has to do somewhat with genetics, getting a little older, your diet, your lifestyle, your nutrition, do you exercise? All those other factors can really play into hypertension problems. And then the second one is called secondary hypertension, where there is really a specific underlying condition that's causing your blood pressure to rise. Your diabetes, your thyroid problems, things like that. So a lot of these things have to do with decreased blood supply to the heart, to the brain, to the cardiovascular system. Again, as you get older, unless you're doing all the right things, your arteries are getting stiffer, maybe your arteries are getting a little more narrow, and those are risk factors that can raise up your blood pressure, and things that can cause stroke, heart attack, and certainly the underlying hypertension as well. So these are some of the risk factors that actually can be controlled. Things like thyroid problems, tobacco use. Do you drink a lot of caffeine in coffee? We're going to talk about that today. Some of you may not be very happy with me when I talk about coffee, but we'll talk about that as well. So there's a number of things that can be controlled, and then there's certain things that can't be controlled as far as stroke and heart attack and hypertension. We're all getting older. You can't really control that. And I always say to patients, it's better to be getting older than not getting older. Does everybody agree with that pretty much? Okay. Then there can be genetic variabilities. If you've had a previous heart attack or stroke, and if you haven't made the changes in diet, lifestyle, exercise, nutrition that you should be making, and you're just kind of going along with what you normally do. I listen a lot of times to a personality on the radio who's had multiple heart attacks, and he still jokes about, yeah, we ate donuts for breakfast this morning, and we don't really exercise, and yeah, I drank a lot of beer on the weekend. You are a walking heart attack about to happen, again, because they haven't made any changes. So here's a big one. Everybody knows this. Smoking, yes, it raises your blood pressure. It increases your risk of heart attack, stroke, and yes, it causes cancer. But people still smoke today. So here's a little chart of what happens if you quit smoking, if you're still doing it. Within 20 minutes, your blood pressure goes down to normal and your heart rate goes down to normal. After a year, your risk of heart disease is now 50% lower than someone who still smokes cigarettes. So it's a really important factor in health. So let's talk about the major metabolic imbalances that really can cause heart disease, hypertension, stroke, cardiovascular disease. All of the studies show that unfortunately between 88 and 93% of Americans are not metabolically healthy. So that's a concern. And this is one reason why people come in a lot of times with elevated blood pressure or they have heart disease or some other issues. So we're going to talk about those factors in particular. So anybody know what's the number one risk factor for heart disease and hypertension? Take a guess. Well, stress, genetics, those are secondary issues. The number one issue is chronic inflammation. Substantial, 90% of heart attacks, 90% of people that have hypertension and other cardiovascular disease have chronic hypertension or chronic inflammation. So what does that really mean? Well, inflammation can be a good thing. Your body, you get cut and the cut swells and gets red and irritated and then it heals up over time and goes away. But inflammation in your body that never goes away, that your body is chronically inflamed, that's the big problem. And it affects your blood vessels, your heart, your brain, all your other organs in the body. So there are some blood tests that are inflammatory markers that your doctor should be ordering on you all the time, especially in the beginning. But they don't. Why? Because Medicare doesn't want to pay for it. That's why. And they're not expensive. So homocysteine. Now, when we look at blood work, we look at it from a couple of different perspectives. We look at what the lab range is, but the lab range, unfortunately, is based on sick people. So what labs around the country do is every once in a while they gather all this data from people who've gone in for their blood work. And admittedly, most of the time when people go to get their blood work is because they're sick and their doctor has sent them for some blood work. So we're looking at sick people. That's what the lab ranges are based on, sick people. And as our population keeps getting sicker and sicker, they keep moving the goalpost. I don't know how many times now I've heard patients that are diabetic come in and they say, well, my doctor's real happy now that my A1C is 7. Well, that's not good. Your A1C is still diabetic, but the doctor's happy because we've reached that. Now the goalpost has moved a little bit. Ideally, you want it to be below 6.4 or 6.5 for your not to be non-diabetic, but they're changing the goalpost. The other way we look at blood work is we look at what's called the optimal or the healthy range. That's inside the lab range. And functional medicine doctors look at this specifically because that tells us not what the lab says about being sick, but it's based on healthy people. So it's inside the lab range. It tells us more about how your body's functioning and working as opposed to, it's too far, it's high or low. And now potentially the highs and lows in the lab range mean that your body's breaking down, tissues are breaking down, and maybe you've got some damage going on in your body. Outside of the functional range or the healthy range doesn't necessarily mean that you're sick at this point, but it means your body's not working like it's supposed to. And if those numbers keep moving further and further to the opposite ends, the high and the low, then we have a bigger problem. So we look at things like homocysteine, which is an amino acid. Homocysteine, CRP, fibrinogen, ESR, even insulin. These are all inflammatory markers. These are early markers that can tell us 10 to 15 years ahead of time if you're headed down the wrong road, if you're headed toward hypertension, cardiovascular disease, even Alzheimer's and dementia. Everybody should be checked on these by their doctors, at least initially, at least the first visit, but they don't. So homocysteine, the healthy range is 6 to 8. CRP, C-reactive protein, you want to be below 1. That's the ideal healthy range. Fibrinogen has to do with blood clotting. You want to be between 200 and 300. Now look at the ranges, 193 to 507. And insulin, you would think, well, insulin doesn't have doesn't that have a lot to do with blood sugar? It does, but insulin is a really, really critically important marker. If I was only allowed to do one test on somebody, it would be their insulin level. That tells me about their insulin resistance, their inflammation in the body, how metabolically healthy they are. It really depends on insulin. And you want your insulin number to be 5 or less. I have diabetics coming in on medication and their insulin is in the 70s and 80s. Their diabetes is wildly still out of control, but their doctor doesn't think it's that big a deal. No, these are specialty tests, but they're inexpensive. I think insulin is $12, homocysteine is $10, CRP is 8. I don't know. I don't remember. You read something like that. They're very inexpensive tests that can be done. But again, Medicare doesn't want to pay for them, so your doctor doesn't want to step on Medicare's toes and doesn't order them unless there's a specific reason for it. Even Time Magazine, ESR is erythrocyte sedimentation rate. It's how fast do your red blood cells settle. If they settle too fast, it means you're inflamed. If they don't settle fast enough, you're not inflamed. Okay? So those are all part of the inflammatory markers. Even Time Magazine says chronic inflammation is the secret killer. It's not really the cause of the problem. It's like adding gas to the fire. It's the underlying fuel to the fire. Basically, that's what inflammation means. Your body's on fire. So homocysteine itself, elevated homocysteine, is a really, really important marker to tell us if you're headed toward cardiovascular disease, hypertension, and even Alzheimer's and dementia. And here's some of the numbers there. So the lab range, again, is between 2 to 19. It's a very strong predictor. Again, it can predict 10 years down the road if you're going to have a problem. And the whole point of it is, let's fix it now before it becomes a problem for you in 5 or 10 years from now. So healthy range, again, 6 to 8. 5 points above that increases your risk for Alzheimer's and dementia and cardiovascular disease by 40%. So again, it's a really important marker. Every 5-point drop in homocysteine relates to it or translates to a 49% lowered risk of Alzheimer's, cardiovascular disease, and a 50% lowered risk of dying in general. So again, really important marker. Your doctor should be testing that on you. So people often ask, well, how do I get my homocysteine to come down? This may shock some of you, but I'm a big proponent for some patients of the carnivore diet. You've all probably heard about the carnivore diet. Some people think, oh, I can't do that. Eating meat only? That's crazy. Well, there's a lot of good studies on it that shows it's actually the proper human diet. It's the most anti-inflammatory human diet is actually the carnivore diet. I'm putting together a presentation on carnivore, ketovore, and ketogenic diet that we'll do next year probably in one of these talks to go in more detail. But the point is, you can get a lot of the important B vitamins that you really need to reduce your homocysteine level by eating a proper diet. Now, some people, we do supplement with B vitamins, B6, B12, the right form of folate, not folic acid. But a common carnivore diet is beef, butter, bacon, and eggs. Very healthy diet. Some people think, well, that's boring. I don't think I can do that. I've lost 25 pounds recently doing that exactly. So C-reactive protein, another inflammatory marker. We talked a little bit about that. And ideally, you want to have your CRP as low as possible. It is an inflammatory marker, again, and increases your risk of developing heart disease, hypertension, Alzheimer's, and dementia when it's elevated. And again, how do we lower CRP levels? Well, again, carnivore, ketovore diet is the most anti-inflammatory diet. And then having healthy fat and oil in your diet. Yes, I said fat. We've been told for years that fat is bad, right? Everybody remember that? Don't eat fat, no cholesterol. I never told patients that over the years. I've been doing this almost 45 years now. We never told patients that because we realized that fat is really an important part of your brain, your immune system, making vitamin D, how your nerves work properly. A lot of important things. So the best fats are things like palm oil, olive oil, avocado oil, macadamia nut oil, butter. Yes, I said so, butter. Now, don't eat something that says, I can't believe it's not butter, because it's not butter. That's not healthy for you. Margarine was one of the worst things ever invented. Tallow, lard. There are some restaurants now that are using only tallow. Steak and Shake, believe it or not, is one of them. There's some other restaurants that are using tallow to cook the food now because they all realize that it's a much healthier way to go. And then there are some seafood and fish sources of healthy fats and protein in the diet too. One of the acronyms is called SMASH. Salmon, mackerel, anchovies, sardines, herring, and some of you are thinking, oh, I can't eat any of that. Maybe salmon, but people generally don't like sardines or herring or stuff like that. But these are good, healthy fats. And there are some nuts that can be eaten, walnuts, almonds, pecans, Brazil nuts. So there are some other healthy foods, even for somebody who's on a carnivore diet. And then, of course, there's the high-fat Mediterranean diet. A lot of people have heard about that. Now, carnivore may not be for everybody. Ketogenic may not be for everybody. Mediterranean diet may not be for everybody. But there's a lot of studies that show that what you've been told about how fat clogs up your arteries is totally, completely wrong. Fat doesn't make you fat. In fact, eating enough fat in your diet can help you lose fat and lose weight. It doesn't clog your arteries. It doesn't give you cancer. It doesn't give you heart disease. These are studies that were done in the British Journal of Science and Medicine. Saturated fat does not clog arteries. Coronary disease is a chronic inflammatory condition. Didn't I just say that? The risk of which can be effectively reduced from healthy lifestyle interventions. So there's a lot of now new studies that keep showing this. It's not elevated cholesterol that gives you a heart attack. It's not eating fat in your diet. In fact, those are things that actually are healthy and can prevent you from having a heart attack and a stroke. So Mediterranean diet, insulin resistance, too much carbs, too much sugar, that'll raise your blood pressure. It'll also cause type 2 diabetes, which we all know that. Not having enough omega-6, omega-3 healthy fats in your diet can also cause heart disease, cardiovascular disease, and lead to plaquing in your arteries. So again, it's not the fat that's doing it, it's lack of fat, too many carbs, too much junk food, too much sugar, too much alcohol. All those things contribute to the problem. So Mediterranean diet may be for some people, carnivore may be for some people, ketogenic may be for some people, or a combination of those things. Here's another factor that leads to metabolic, you're not metabolically healthy. We look at your waist and hip ratio. Your waist-hip ratio, you can see on the chart here, for men, excellent is 0.85. I just checked mine this morning. It's 0.75, so I'm well below the excellent right there. You want to be lower is better. So we measure your waist right above your iliac crest, measure around your hips where your femur heads are, and you divide your waist by your hip ratio, and that should give you a number here. For women, less than 0.75, and it goes from excellent to good to average, at risk, and to high risk. Another ratio that you can look at is your waist to your height ratio in inches. So I'm 67 inches, 5'7", and that number for me should be half of that. So it should be 33 and a half inches. My waist is now 30 inches. So those are things, simple measurements. You can do it yourself. You don't have to go to a doctor to have that done. And that can tell you if you are part of the metabolically healthy or unhealthy. We look at that factor. And then the main thing we talk about also is your blood pressure. So ideally, you want your blood pressure to be below 130/80. That's a healthy blood pressure for pretty much anybody without being on blood pressure medication. So high blood pressure is a major indicator of being metabolically unhealthy, poor metabolic health. So again, a lot of times now, what happens when you go to the doctor, and medicine has been changing rapidly toward this now, we call this medicine painting by the numbers. In other words, all your doctor's focused on is the numbers. What's your blood pressure number? What's your cholesterol number? What's your triglyceride number? What's your LDH number? That's all they really care about anymore is your numbers. How many of you have your doctor has asked you, again, the questions I ask every one of my patients each time? What's your diet like? What's your stress like? What's your exercise like? All those questions are really important to get a holistic picture of really what's going on with your health. You can't just focus on the numbers, but that's where medicine is right now. They're focused on paint by the numbers. What's the number? If your number's above 200 for cholesterol, you need to be a statin. If it's above 120/80, you need to be on a blood pressure medication. So numbers, numbers, numbers. So that's what all the new categories are basically right here, is that essentially, we kind of went through this a little bit before, that's where they want you to be. And if you weren't diagnosed with hypertension before, you probably are going to be diagnosed with it now, especially if your number's above 120/80. So why do they do that? Well, they're kind of doubling down on that for the blood pressure medication. And in a minute or two, I'm going to talk about the new numbers they want for your total cholesterol and your LDL. They're basically doubling down on those numbers as well. So essentially, what they're saying was there's more people that need to be on blood pressure medication, there's more people that need to be on statins, and yet millions and millions of people in this country and in Western Europe are on blood pressure medication and statin medication, and heart disease is still the number one killer. Why is that? Because they're looking in the wrong direction. They're focused on the numbers and they're not focused on what else is going on in people's lives. So standard of care basically is if your blood pressure is above 120 over 80, you're going to get a discussion about all these different medications and maybe two or three of them depending on how high your blood pressure is. And they may say something like, well, eat healthier. And I've had patients tell me, well, they told me to eat healthier, but they never told me what that really means because maybe they don't know themselves. But that's a discussion we have in detail with each and every single patient that comes into our office. So why is this happening? Who controls the standard of care? Well, there you go. Big Pharma controls everything to do with medicine now. They influence the government, industry, medical facilities, hospitals, doctors' education. When I was in medical school, we had a 2-hour lecture on nutrition. My son, who's also a medical doctor, was told the same thing. A 2-hour lecture in 4 years on nutrition, and it was the RDA of vitamin C is this, the RDA of vitamin D is that, end of story. We didn't talk about diet, lifestyle, all the right important things about nutrition. So they control research, they control the manufacture of drugs, they control your education, they control the medical associations, all controlled by Big Pharma. That's why the push is always, what's the latest, newest drug? Now, don't get me wrong, there are some life-saving medications. We all know that, but too often the attitude is, you've got this high number, here's the drug, there's a pill for every ill, and I'll see you next time. And you get 5 or 10 minutes with the doctor and they're out the door. And you've got a new prescription in your hand. But here's something they don't tell you. Long-term use of blood pressure medications can cause kidney damage. Some new studies have come up with that. This was published by the University of Virginia Healthcare System in 2022. So blood pressure medication don't prevent kidney disease. They don't prevent kidney failure, but they are toxic and actually will give you those conditions if you take them for a long enough period of time, which can also lead to the number one cause of dialysis is renal failure, and that's from the blood pressure medication, and it's also from the diabetes medication. So if you're taking both diabetes medication and blood pressure medication, you've got a double whammy now on your kidneys, leading to kidney disease. And so what does dialysis mean? Dialysis means that you're on a dialysis machine 4 hours a day, 3 days a week for the rest of your life. Sounds like fun, doesn't it? Not really, not really. If the problem could have been resolved way back when, before renal failure took place, that wouldn't be needed in the first place. So there are many different approaches to regulating hypertension. Again, we look at certain herbs. There are herbs that can be used. Now, don't go out buying all this stuff because I don't know if you need it. Each person may be a little different what they need. That's what we evaluate. That's what functional medicine, functional nutrition doctors evaluate for each person individually. Treating one person may be totally different than the other person depending on what else other factors they have going on. So there are some herbs that people can use. There are some vitamins. There are some foods that really help. Natural ways, reduce your intake of caffeine, coffee on a daily basis. That'll lower your blood pressure. Exercise. Magnesium may help some patients. There's a lot of good things. Reducing stress, smoking, cutting down on caffeine, limiting alcohol, losing weight, a healthy diet. Those are all factors that each person has to be looked at individually to see what applies to them. Some of them may apply, some of them may not apply, but it's not just, here's your lisinopril, have a good day, we'll see you next time. that is very, very poor medicine as far as I'm concerned. And one of the big things is checking your nitric oxide level. We do this all the time on patients. We have a little test strip. Nitric oxide is a gas that your blood vessels produce, keeps your arteries dilated, keeps your arteries flexible. Real important for keeping detoxification going in your body. We have a lot of it when we're young, but like everything, you hit 40, 45, what happens? Things start to go downhill a little bit sometimes, and you don't produce as much nitric oxide as you should. But again, that can be done by diet, exercise, nutrition, eating the right foods. Those are all things. Beets are a great way to increase nitric oxide production. Doing some cardio exercise, not necessarily being on the treadmill for an hour a day, a 15, 20-minute walk a day can increase your nitric oxide production. So again, there's a lot of different things that can be done to basically open up the blood vessels, lower that blood pressure. Um, the fourth issue that we deal with is metabolic syndrome. Are you metabolically healthy or not? This is one of the most important ones, and this really goes into a lot of cardiovascular disease. So what's metabolic syndrome? So metabolic syndrome means you have insulin resistance. In other words, you're forcing your pancreas to produce more and more and more insulin to handle the sugar load that you keep shoving into your face and down into your body, and your body can't deal with that anymore. So now you're pre-diabetic or you're diabetic. It also raises your blood pressure. It also increases central obesity, that little basketball you've got in your belly. And it also causes imbalance in things like triglycerides and HDL and LDL. We're going to talk about all of those in a second. Metabolic syndrome is kind of really pre-diabetes. You're on the path to pre-diabetes and to diabetes. And you're a heart attack in the making, but before you have your heart attack, your blood pressure's probably been elevated for a while because you've got metabolic syndrome. So let's talk about some things about what your doctor will talk about, especially to do with how to heal your heart um, interiorly without using medication. And one of the big things you have to realize is that I know your doctor focuses on your cholesterol number and your LDL, right? They talk about that. And all the current research, and I have some slides on this in a minute here, they'll show that that's not as important as your doctor is telling you because they don't know what else to tell you because that's how they've been trained. But let's talk about this concept first. Good and bad cholesterol, right? Everybody's been told there's good cholesterol and there's bad cholesterol. And unfortunately, none of that is true. It's all just cholesterol. There is no good or bad cholesterol, and we're going to talk specifically about that. And again, once the doctors are just focused on the numbers, your LDL is this, your cholesterol number is this. They don't even really look at your triglycerides most of the time, but that's more important than your LDL and your cholesterol. Triglycerides tell us how much sugar and fat's in your body and how much inflammation you have. So once again, we're back to paint by the numbers. Whatever your numbers are, that's how bad they think you are, and we've got a medication for that. So let's talk about LDL, the supposedly bad cholesterol. Well, LDL is not really cholesterol. And in fact, on a standard blood test, when they do your blood work and it reports LDL, it's really a calculation. It's not even a measurement. So I don't know how accurate it really is. There's different types of LDL. And basically, LDL is a taxi cab. It's a protein carrier that moves cholesterol around the body. Cholesterol is really an antioxidant. It's really an important part of every cell membrane of every cell in your body. 25% of your brain is made of cholesterol. 80% of your brain is made of fat. 85% of the cholesterol that's found on your blood test is actually made by your liver. So think about this. If the good Lord made our bodies to make cholesterol, maybe it's kind of a good thing that we actually make cholesterol. Only 15% of the cholesterol on your blood test is from your diet. If you're eating more cholesterol and more fat, your liver is going to shut down the production of cholesterol. If you're not eating enough healthy fat or cholesterol because your doctor has wrongly told you this for the last 30 years, your liver's making more and more cholesterol, and then you have to artificially try to control it with the statin medication. But that's a whole nother talk that we do on statins and all that. But anyhow, if you have any area in your body where there's damage, injury, inflammation, infection, trauma, your liver is going to make more cholesterol because cholesterol actually is used to heal things in your body. And you need the LDL to move the cholesterol to areas that need to be fixed. So, like I said, it's a taxi cab. By trying to lower your LDL, what your doctor is decreasing your body's ability to repair damage in your cell membranes, in your cells, reducing the production of important steroid hormones from your adrenal glands, your sex hormones, progesterone, testosterone, estrogen. It's also important for the production of bile salts so you can emulsify and break down fat. It's also important for the transport of fat-soluble vitamins and minerals to areas of the body where they need to be to, to work for your body to use them. It's also important for your immune system to function properly. People whose LDL is being driven down and down and down, they are some of the sickest patients I see because their immune system is getting more and more compromised. You need LDL for your immune system to function to kill off bacteria, parasites, viruses, things like that. So they're basically their repair crew in the body. And again, think of them as a taxi cab. Now, just recently, this year, the American Heart Association, the American Cardiology Association has said that everybody's LDL needs to be below 55. Think about that. They are trying to kill you. I'm serious. They're not considering things like, oh, your insulin resistance, your weight loss, how much sugar you eat, how much exercise you do. These are all things, a healthy lifestyle, these are all things that can naturally balance your cholesterol and LDL. No, they want to double down on what the drug we need is to get your LDL, which they consider bad cholesterol, although I've just told you there's no bad cholesterol, it's just cholesterol, and there's different types of LDL. And now they wanted to check it in children as young as 9 to 11 years old. Why? So everybody can be on a statin. I hate to sound conspiratorial, but it's just what the reality is. There are a lot of cardiologists, a lot of medical doctors who are very upset with these new guidelines from the Cardiology Association and the Heart Association. It's ridiculous. They're just trying to push more and more statins on people as if that was the answer to everybody's health problems with heart and hypertension. So they want to have an aggressive target of right now they want you to be below 100. The aggressive target is less than 55. They also want everybody's cholesterol now to be below 170, the total cholesterol, not 200. Why? So more people need to be on statins. When I was in medical school, the nice-looking blonde lady from the pharmaceutical industry came in to talk to all the doctors, and she said, eventually, we want everybody's total cholesterol to be below 100. And I raised my hand, and I literally said, are you trying to kill people? Because that's what you will do if everybody's total cholesterol is below 100. So think about this. What happens to the cholesterol in your brain when your total cholesterol starts dropping down? It starts getting down too. That 25% drops down. That's a major reason why we have an epidemic of Alzheimer's and dementia now, because of the statin medications are lowering everybody's total cholesterol, and it's affecting their brain as well. So let's talk about the good cholesterol, HDL. Well, again, HDL is not high-density lipoprotein. It's not cholesterol. It's a protein carrier that moves cholesterol. After the body has been repaired, it takes the excess cholesterol that's been used and moves it back to the liver to be recirculated or eliminated. So again, it's a protein carrier. It's not a good versus bad cholesterol. It's the cleanup crew. It fixes things. Do we need to go back to that? Okay, there you go. Anyhow, you can see that, again, it's another taxi cab. And there's some studies that were also done, this is back in 2016, that the conclusion of the study basically is that elderly people with high LDL live as long or longer than those with low LDL. In other words, the higher your LDL, the healthier you are, and the longer you live. That's exactly opposite of what your cardiologist and these guys that are putting these new guidelines out that want to drive your cholesterol down as low as possible. It also increases your risk of developing cancer. That's what all the studies show, but they're not going to tell you that. Now, there is a test that can be done to see if your LDL is the good LDL. There's a good or bad LDL, but it has to do with the particle size of the LDL, not so much with the amount that's in your system. And the LDL is broken down into different particle sizes. And what I mean by that, there's pattern A and there's pattern B, and there's some other patterns. Pattern A is basically the light, fluffy transport LDL that moves cholesterol around the body to areas that need to be fixed. So here's a good example of it. If I stood up here and I had a bag of cotton balls and I started throwing them at you, you wouldn't get hurt. You may be a little angry or annoyed with me, but I wouldn't hurt you if I threw cotton balls at you, right? Pattern B is the type of LDL that causes damage to the interior lining of your blood vessels. It's like standing up here and shooting you all with a BB gun. Not only would you be angry with me, you'd be hurt too. That's what pattern B LDL does to your body. What causes pattern B? Chronic inflammation, oxidative damage, and too many carbs, including fructose, which you're eating too much sugar, high fructose corn syrup. That's what changes your good LDL to the pattern B bad LDL. But your doctor doesn't talk to you about that. So we have to also look at some ratios, some numbers here. So one of the things that I look at on every single patient is I like to look at their triglyceride and their HDL ratio. So you divide your triglycerides by HDL. Triglycerides should be below 100. That tells me how much sugar and fat, especially if you fasted for 8 to 10 to 12 hours before your blood test. If you're metabolically healthy, your triglycerides should really be between 50 and 100, definitely should be below 100. If you fasted and it's above 100, you're not metabolically healthy. You've got too many carbs and junk food in your diet. So what raises triglycerides? Sugar, too much junk food, including chips and pretzels and all that stuff that's converted very quickly to sugar, too much alcohol, and yes, fruit can be good, but some people tend to overdo the fruit, and all that fructose will also raise your triglycerides, which is not a good thing. So ideally, you want your triglyceride HDL ratio to be below 2. That's just a magic, it's a magic number there. So the other thing that goes along with this is the whole cholesterol, heart disease, hypertension, we call it myth. And there's lots of studies now that show fat and cholesterol cause heart disease, may be one of the biggest health myths of all time. That was published in PubMed, published by the National Institute of Health, and a whole bunch of journals. But your doctors aren't telling you that. Why? Well, they've all been trained to believe that elevated cholesterol and fat cause heart disease. And that was all based on some studies that were done in the 1950s, promoted and published by the Sugar Research Foundation, which basically found, and this came out in 2015 in the Journal of the American Medical Association, back in the 40s and 50s, they found that it was actually sugar and inflammation that caused heart disease and heart attacks, not fat and cholesterol. Well, that was devastating to the Sugar Foundation and to the sugar industry. So what did they do? They hired some Harvard professors to write articles saying it was fat and cholesterol that caused heart disease. So for the last 50 plus years, everybody's been trained fat and cholesterol cause heart disease. In fact, back then they said sugar was actually good for you. It's just wasted calories. It doesn't do anything to you. Well, we now know that that is not true. That is really a big cause of heart disease. So eating a low-fat diet doesn't prevent heart disease or help you live longer. It turns out there's really no correlation between eating fat and cholesterol in your diet. And in fact, the National Institute of Health says that increasing your fat calories to 50% will actually have a much improved nutritional status for your heart, your blood pressure, and your overall health. This is from the NIH. This is not me saying this. High-fat diets actually will lower your triglycerides, lower your fat percentage, and that's the big thing, is the visceral fat, the fat that lines your organs, not the little fat you see on your belly. It's the internal fat. That's the dangerous fat. That's the inflammatory stuff. So what they're telling you about eating low fat, no fat, totally, completely Wrong. Wrong information. And this is from Harvard Medical School, the same thing. They call it the low fat fail. Low fat, low cholesterol has not improved anybody's health, and it's actually made everybody's health worse. Why did that happen? Because people actually listened to what the government said back in the mid 1970s, and people stopped eating fat, low cholesterol, and they ate more what? Carbs. And that's why we have this epidemic of diabetes, obesity, Alzheimer's, dementia, and heart disease. And I didn't believe it, but I did some coursework at Harvard, and they actually said that in the coursework that I did, that low fat, no fat is not the answer. So that's from Harvard. There was also a study done by the American Heart Association called the Lion Diet Heart Study. And what they did was they recommended the typical American Heart Association, Cardiology Association diet. Low fat, low cholesterol, eat more grains, eat more carbs. And they compared that with people who were on the Mediterranean diet, which was high fat. They had to stop the study because people on the American heart diet were dying at a much more higher rate than people on the Mediterranean diet. So they thought it was unethical to continue the study. So their own diet didn't work. There's a doctor, a cardiothoracic surgeon, Dr. Lundell in Arizona, that basically says if you eat low fat, no fat, what happens to the inside of your arteries, it's like taking a brush and rubbing the brush over your skin for hours at a time during the day. Your skin will bleed and get red and raw. That's what happens to the arteries, the inside of your arteries, if you don't eat healthy fat in your diet. And he's done thousands of heart operations on people, low fat, no cholesterol. So fat, really important to avoid trans fat, hydrogenated fat, but you want to eat the healthy fats. You don't want to eat fats found in chips and margarine and all this junk food. Again, butter, margarine is not good. Butter is good. Tallow, lard, and the healthy oils, avocado oil, macadamia nut oil, olive oil, coconut oil. Eating junk food, again, not very healthy for you. It causes chronic inflammation in the body. So here's a list of good fat versus bad fat. Nature doesn't make bad fats, factories do. Remember when canola oil came out? They told everybody how healthy it was. That was one of the biggest lies ever promoted. None of the seed oils, soybean oil, sunflower oil, corn oil, safflower oil, grapeseed oil, and margarine. All really, really poor sources of fat. Butter, tallow, lard, palm oil, coconut, avocado, olive oil. Those are the fats. The best fat is in eating red meat. That fat that's on the cow that you're eating the meat, that's one of the best sources of healthy fat you can eat. It's in your diet. And of course, people like avocados. I said you're the good kind of fat, avocados. Um, the president of the American Heart Association, who promoted all this low fat, low cholesterol, their stance on it, had a heart attack at 42 or 52 following his own advice. And they came out big time saying nobody should ever use coconut oil. It's bad for you. Well, they're wrong about that too. Coconut oil, yes, it's a saturated fat, but 50% of your brain is made of saturated fat. So it's actually a healthy thing for your brain. So here's some advice on how to lose fat. Take a walk. That's one of the simplest things that you can do. You don't have to walk for hours at a time. You want to walk for 15, 20 minutes to start at a good pace. That you want to be able to talk to somebody. You don't want to be out of breath. If you walk too fast or run even, if you're out of breath, you're raising your cortisol level, which can cause more inflammation and actually cause more hypertension issues in the body. So take a good walk. Be at a little bit of calorie deficit. Eat less than you burn. Do a little bit of strength training. You don't have to be Arnold Schwarzenegger in the gym 3 hours a day, 5 days a week. A little bit of resistance exercise can help your muscles. Your muscles are your metabolic furnace, meaning your muscles determine how much calories you burn, how much fat you burn on a daily basis. Do a little bit of cardio, but you don't want to be on the treadmill for an hour at a time. 20 minutes, half hour the most. Focus on sleeping. That's a really important overlooked thing. Most people don't get enough good quality sleep. And there can be underlying issues why that happens. But you need at least 7 to 8 hours sleep a night There are a lot of studies that show that someone who sleeps too much, like 9, 10, or more hours, it's actually detrimental to your health because there may be some underlying issues there. And be patient. It takes a little time to lose some of the fat that you've got in your body. So here's a good exercise. Place a block on the floor, walk it around it twice. Tell everybody you walked around the block twice. Okay. All right. So these are some other ratios that your doctor won't talk to you about, but I check on all my patients to see where your metabolic health really is. Again, insulin. We want to see your insulin number down below 5, not the lab range up to 24.9 or higher. You also want to look at your HDL cholesterol ratio. Divide your HDL number by your cholesterol. And you want that to be above 24%. It tells us that you're metabolically healthy. You want to look at your cholesterol HDL ratio. Divide your cholesterol by HDL instead of HDL by cholesterol. That one you want to be less than 5. Again, another important metabolic marker to see how metabolically healthy you are. We talked about the triglyceride HDL ratio. You want it to be below 2. And you want your LDL HDL ratio to be below 3. These are all things that you have right on your blood test. It's right on your blood test. You just have to calculate them out. It takes you 30 seconds to do each one. Very, very, very simple. So some of you are going to be really mad at me about this. I'm not a really big fan of drinking coffee on a regular basis. Here's why. Yeah, I know coffee is one of those things. Last year it's great. This year it's not so good. Back and forth, back and forth. Is it really good? Is it not? There may be some positive effects, some negative effects, but the main thing I'm looking at with coffee is all the other hidden issues that nobody talks about. So what's wrong with coffee? Coffee is one of the most heavily sprayed crops with pesticides. Now, some people will say, well, what about organic coffee? Well, that depends. Are you really getting organic coffee that's not sprayed with chemicals? About 10 years ago, they did a study on all organic wines in California, all the vineyards that were growing organic grapes, organic wines. Every single one of them were contaminated with Roundup. They weren't using it, but the neighboring farm was, and it was coming over. So very heavily sprayed with crops you're making basically coffee really is you're making a watery solution of burned beans that have been exposed to chemicals and pesticides. That's my feeling on it. It's also very acidic, which changes the way your body pH is, which can cause more inflammation in the body. It also stresses your adrenal glands, which will elevate your cortisol. And when your cortisol goes up, which is a stress hormone, it will also reduce your insulin, which means your blood sugar goes up. So there's a problem there. It also affects the normal flora, the good probiotic bacteria in your intestines, which also can raise your blood sugar, kills off the good bugs in your intestines, lets the bad ones survive. It also raises your pattern B, the BB type of LDL. So that's not such a good thing. And it also, every time you roast those coffee beans, you produce a chemical called acrylamide, which is a carcinogen. Every single Starbucks and coffee shop in California now, on the coffee cups, it's labeled, this is a potential carcinogen. And then most coffee is full of mold or mycotoxins. So some patients will insist on coffee, and if you're really going to insist on it, organic coffee, if you can trust the source of it. But there's another source, bio coffee. Anybody ever tried bio coffee? Bio coffee is much, much healthier. It's mostly wheatgrass. It's alkaline. There's no caffeine, but you're still getting that energy boost that people like. It's 100% organic, and it's naturally decaffeinated Arabica coffee beans. There is no caffeine in it. So it's a good, better choice. And then, of course, we talked a little about sugar, which causes oxidized LDL, the pattern B LDL. It elevates your blood pressure, and sugar is addictive. Why do you think they put some type of sugar in every type of junk food out there? Read the label. It may not say sugar. It may say dextrose, maltodextrin. It's sugar because it's addictive. You know that? Remember that old TV commercial that you can't eat just one? Remember that for Lay's potato chips? Well, they're right. You won't eat just one, maybe one bag, but not just one chip because it's so addictive. So This all causes your insulin to spike up, and elevated insulin causes high cholesterol, high blood pressure, cardiovascular disease, obesity, diabetes, dementia, Alzheimer's, and cancer. And this is a chart that the government put out that back in 1976, this is when the low fat, low cholesterol guidelines came out. This chart also could be for obesity, diabetes, Alzheimer's, and dementia. Since people listened and started avoiding fat and cholesterol, all these problems have skyrocketed because they substituted junk food and carbs for it instead. So, the fifth type of metabolic problem, obviously, is type 2 diabetes. You want your glucose level to be really in the 80s to low 90s. These days, I really talk about it being in the 80s. Your fasting glucose. Your A1C should be between 4.8 to 5.6. 5.7 and higher is prediabetes. Above 6.5 is, or above 6.4 is diabetes. And again, your doctor doesn't normally check your insulin number. They should. And that tells us a whole lot more about what's going on with your body. You want your insulin to be below 5 or less. And that can be accomplished by your diet. So we know after all these decades of preaching low fat and more carbohydrates, diabetes is up over 700% in the last 50 years. And it's actually doubled in this country in the last 10 years because it's out of control with the diet people have. Obesity predisposes you to 3 of the 5 top leading causes of death in the world. Heart disease, still number 1. Cancer, number 2. Number 4 is diabetes. We call it diabesity because obesity and diabetes are so closely linked. Number 3, what's the third leading cause of death? Properly prescribed medications by your doctor. And that was published in the British Medical Journal, also published in the Journal of the American Medical Association. Properly prescribed medications. That doesn't include all the over-the-counter stuff that people die from every year, like Tylenol and ibuprofen and stuff like that. And the last thing we look at for metabolic health is your coronary artery score, and that's a CT that your doctor can do on you. And that's becoming more and more prominent now. The CAC, it's funny. Well, it's not funny. It's sad. A lot of times patients will come back and their CAC score is 0, and yet the doctor insists that they still need to be on a statin because their cholesterol is 201. It doesn't make sense. If your calcium score is 0, what the heck are you doing on statins? You don't need it. It has nothing to do with your health. But they still insist on that. Again, that's paint by the numbers. So a lot of problems with the calcium scores also are caused by doctors recommending mega doses of calcium. So if you're a woman who has either been diagnosed with osteopenia or osteoporosis, what does your doctor tell you? You need 12 to 1500 milligrams of calcium a day, end of story. That is not the answer to osteoporosis. We just did a whole talk on that a couple of months ago here. It's not all that calcium. Too much calcium, your body can't absorb it. And what happens is you don't get rid of it. It gets deposited as plaque in the arteries of your heart and in your brain. So we don't want that issue. And calcium took off. It's in orange juice. It's in applesauce. Is it in beer? I don't know. Do they put calcium in beer too? But it's everywhere, right? Calcium is everywhere. So lots of studies show that you don't want to take all that calcium in excess. And what about genetics? Is hypertension genetically controlled? Well, what we do know is that there are some families where family history of hypertension, but the big issue with that is the whole study of what we call epigenetics. Epigenetics is really diet, lifestyle, nutrition. What you do, what you eat, what you're exposed to, do you exercise? Just because you have the genes for something doesn't mean you necessarily have to have the problem that's been passed down to you, because if you take better care of yourself, which means that 80% of genetic variabilities can be dealt with by diet, nutrition, lifestyle changes. So it's not necessarily that you're destined to have the problem. Blood tests can tell us what's not working in the body. Genetic testing can tell us why your body's not working, but more specifically, what we can do to bypass or correct for genetic variabilities. You can't change your genes. You can't do anything about the genes that you've been handed down from your parents and grandparents, but you can do things to make some changes with the genes you've been blessed or cursed with, I guess. So, if you don't make time for your wellness, you'll be forced to make time for your illness. Think about that as well. So I like this quote from Dr. Greenberg. We always end with this. As a retired physician, I can honestly say that unless you were in a serious accident, your best chance of living to a ripe old age is to avoid doctors and hospitals and learn nutrition, herbal medicine, and other forms of naturopathic medicine or natural medicine, unless you're fortunate enough to have a naturopathic physician available. Almost all drugs are toxic, and they're designed only to treat symptoms and not cure anybody. Does that make sense? Okay. All right. Questions?